The VA St. Louis University Mental Status Examination, or SLUMS examination, is a tool that we use to identify cognitive dysfunction. And we do this by asking a series of questions and calculate a score. It's a 30-point score for perfect responses. And we use education to stratify the patient's score. And we can help to identify either normal or mild cognitive impairment or dementia states. Hello, Mrs. Smith. Nice to meet you.
Hello, nice to meet you.
Today I'm going to be going through the VAMC SLUMS examination, and at the end I'm going to calculate a score and then talk with you about what that means for you. Okay? First of all, what is your age?
79.
Okay. And how many years of school have you completed?
Through graduate school.
Okay. All right. First question is, what day of the week is it?
Thursday.
Okay. And what is the year?
2008.
What state are we in?
Missouri.
Okay. Now, I'm going to ask you 5 objects to remember. I'm going to say them to you first, have you repeat them back to me, and then I'm going to ask you to remember them a little later.
In the same order?
It doesn't have to be the same order.
All right.
Okay. And these objects are apple, pen, tie, house, car. Can you say them for me?
Apple, pen, tie, house, car.
Good. Okay. The next question is, you have $100 and you go to the store. You buy a dozen apples for $3 and a tricycle for $20. How much money did you spend?
$23.
Okay. And how much money did you have left?
$77.
Okay. We prefer to use the SLUMS for assessing cognitive function because it's much more sensitive than some of the other tools that are available. And it also allows us to stratify individuals early before they actually are fully demented, and perhaps at that point intervene and make the diagnosis earlier. Now, I'm going to have you name as many animals as you can in 1 minute. All right? So I'm going to set my watch. Ready? Begin.
Cats, dogs, horses, cows, birds, parakeets, parrots.
One of the questions that people frequently have problems with is naming of animals. They have 60 seconds to name as many animals as possible, and we're hoping they can name at least 15 animals. They do not get points if they rename the same animal more than once. And what we frequently see is people will think of animals within a certain category, say barn animals or zoo animals, and they won't be able to transition to another category of animals in order to think of 15 or more. Earlier I gave you those 5 words and asked you to remember them. Can you tell me those 5 words I asked you about?
Apple, pen, I don't know.
When we ask them the 5 questions back, frequently people can recall 1 or 2 or sometimes 3 items, but this is a very common area where people are unable to complete the entire task correctly.
I can't remember anymore.
Okay, we'll move on to the next question. Now I'm going to give you a series of numbers, and I'd like them spoken back to me backwards. So if I say 4-2, you would say 2-4.
All right.
Okay? 8-7.
7-8.
6-4-9.
9-4-6.
Okay? 8-5-3-7.
7-3-5-8.
Okay. The next task is, when we ask someone to draw a clock, we're actually asking them to do several different tasks simultaneously. They have to recognize that there's a circle on the paper, and that represents the face of a clock, and that you would put numbers on the face of the clock in order to put the right time on that clock. A good clock should have all 12 numbers in place in the correct position, and they get 2 points for doing that. Should have both hands on the clock, and those 2 hands should be in the correct position, and they receive 2 points for doing that correctly. For the most severely impaired individuals, they may not be able to put any numbers on the paper at all, or they'll put the numbers outside of the clock ring, or not be able to complete all the numbers on the clock in a circular fashion. In the very demented individual, we also find that they frequently are not able to put hands on the paper at all. Now, also on this piece of paper, I'd like you to take a look at these three objects, and I'd like you to put an X in the triangle. In question 10, we're really testing someone's visuospatial abilities, and this is something that is lost fairly early in the dementia process. So we ask the person to follow a command, and the command is to identify an object, that's the largest, and also to identify a specific shaped object. And this can be very difficult for people in the early parts of their dementia process. For this last question, I'm going to read you a story. Listen carefully, because afterwards I'm going to ask you some questions about the story. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and they had 3 children. They lived in Chicago. She then stopped work and stayed home to bring up her children. When they were teenagers, she went back to work, and she and Jack lived happily ever after. Here are the questions I have about the story. What was the woman's name in the story?
Jill.
What kind of work did she do?
Salesperson?
Okay. And when did she go back to work?
When her children were teenagers.
Okay. And what state did she live in?
Chicago?
Okay. Now, I did mention Chicago. What state does she live in?
Chicago.
Okay. Early on in dementia, individuals can recall items they've heard, but they have difficulty interpreting that information. When we ask her for the state, she instead gives us a city. That's the word she heard in the story, but she couldn't interpret that Chicago is actually a city and the state is Illinois. Each question is assigned a certain point value, and as we go through the test, we give them, in some cases, partial credit if they respond partially to the question. In other times, they can only get 1 point, yes or no, right or wrong. At the end of the examination, we calculate their score out of a total of 30, and then depending on their level of education, we can determine whether or not they fall into the grouping of normal or mild cognitive impairment or dementia.
Dual tasking occurs when someone has to do 2 things at the same time. So for instance, when you're walking and talking, we find that it's much harder to do the 2 things together. As we get older, particularly as we start to lose some of our executive function, we find that when you have to do 2 things together, when you have to dual task, you tend to fall, misstep, and slip. Therefore, classically in the doctor's office, we have tested people only doing a single task as far as walking is concerned. When we want to know how they're going to perform in the real world, we have to test them doing 2 tasks at the same time. Mrs. Leach, it's so good to see you today. How are you doing?
Doing okay.
I understand you've been having some trouble with falling and slipping, is that right?
Yes, sir, I have on occasion.
Okay, so what we're going to try and do today is test how your walking is, but in particular we're going to add looking at what happens when we distract you, because most of us as we get older, we tend to fall when we're distracted. If we're paying attention, we do well. So I'm going to ask you to do some tasks.
Oh.
And some of them may be difficult, such as doing a little math. I know you're great with math.
Oh my. I'll try.
I'm sure we'll do very well. So if you don't mind standing up now. Okay. In a very short time, by having people do a couple of quick tests, we can find out whether or not their executive function is sufficiently impaired that they no longer can carry out normal walking and balance tasks in the face of having to do something else. Okay, Mrs. Leach, now I'm going to have you take 7 away from 100, 7 away from the remainder, and so on as you walk towards me. So when I say go, you start by taking 7 from 100. So go.
93, 86, 79.
There are a series of tasks that can be used for dual tasking. The first of which is the person is walking, and while they walk, they take 7 away from 100. They then take 7 away from the remainder and continue to do this, saying it aloud. This is equivalent to having a conversation while you walk. What I'm going to ask you to do, Mrs. Leach, is get up from the chair and then walk as quickly as you can towards me. I think that anyone who is getting older where these things happen, we would like to pick them up before they fall, before they have an accident and fracture their hip. The second task, the person will be sitting, they will stand up. This is the classical get up and go, but they will do it holding a glass full of water.
Okay.
So now we're going to do the same thing as we did previously. We're going to ask you to get up and walk towards me when I say go, but without spilling the water.
Okay, I'll try.
You've done so well, so I'm sure this will be good. So when I say go, you get up and walk towards me.
Okay.
Go. And if you notice there, the water is spilling, and there it goes, and she stops. Okay, and that's very good. Thank you. When people fail these tasks, you need to look a little further at what is happening in their life. Are they slipping? Are they falling? Are they at major risk of falling? If they are, if any of these are positive, under those circumstances, you would then put them into a physical therapy program to try and improve their function, both as far as balance is concerned, but particularly in teaching them to walk while performing dual tasks. Okay, Mrs. Leach, now we're going to test your balance, and what I'm going to ask you to do is stand on one leg.
Okay.
The third task we'll look at is just a simple balance task of the person standing on one leg, and then from there being asked to shut their eyes. When they lose their visual input, they often find it difficult to maintain their balance. Shut your eyes if you can while you're up. Shut your eye. Oh, yes, you fell. Okay, we understand when you shut your eyes, people often fall. That's very classical what happens. We find that we pick up people very quickly with this test, and that many of them do extraordinarily well after going through a course of physical therapy for 6 weeks. Well, one last thing we want to do is just try a little bit of dancing. Let's see how well you do at dancing.
Okay.
Well, finally, we'll show how you can integrate this very quickly in an office practice by just dancing with the patient. But you're doing well there. That's really good. That was very nice, Mrs. Leach. You did very, very well. We've got a few little problems. Every person who's older and comes to see a geriatrician should be tested this way, because often people don't recognize they're having problems. But classically, where we would do this is somebody who says they've had a new onset fall, they tend to be slipping, they're having trouble walking. Those are the people classically tested, but certainly anyone over the age of 70 coming for the first time to see a physician or a geriatrician should have some sort of test of their ability to maintain their balance and to carry out dual tasking. So it was really nice to see you today,
Nice
and we're going to
meeting you,
get you better. And when I see you back, you're going to be running around and we'll dance a full waltz.
I love it.
There are several reasons that testing for dehydration is important in our older population. One of them is it's very common. It's a common problem that often goes undiagnosed without any formal assessments. A lot of times the elderly will not feel that they're dehydrated. Unlike younger people who don't drink enough, they feel thirsty. The elderly may lose their sense of thirst, so they could be quite a little bit dehydrated without feeling thirsty and doing something about it. So it's very common. We have to formally screen for it in order to diagnose and detect it. Another reason is, as I said, it's sometimes very difficult. It doesn't always present in the same ways. There are many different symptoms that can result from dehydration, and we need to know what to look for. And it varies in different populations. For example, the clinic patient might present differently from a nursing home patient, and we need to know what to look for in all those populations. And the third thing is dehydration can lead to a lot of negative or adverse effects. Some of which, the common ones, would be things like kidney failure, falls. Oftentimes when you're dehydrated, you can get lightheaded or dizzy, and that can lead to falls, a very common problem, especially in our frail elderly, for example, nursing home patients. Mr. Johnson, I'm Dr. Hajar.
Nice meeting you.
Pleasure to meet you. Thank you for coming in.
Thank you.
What I'd like to do today is we have some questions. I'd like to ask you, screening mainly for dehydration, for being a little bit on the dry side.
Oh, yeah.
That's a fairly common problem, and it's not always that easy to diagnose. So I've got a few questions about your diseases, your background, medical history, and some medications that you may or may not be on.
Okay.
Let me first start by asking about your medical history. Have you ever been diagnosed with diabetes?
Yes, I have type 2.
You have type 2 diabetes. How long have you had diabetes?
Oh, for about 20 years.
Diabetes, especially poorly controlled diabetes, if your sugars are over 200 persistently, the sugar itself can act as a diuretic and make you lose a lot of free fluids. You take medications for that?
Yes, I take metformin.
Metformin, excellent. I want to also ask you whether you have any swelling in the ankles.
Later on in the day, usually, it's fine in the morning, but later on when I've been, on my feet a lot, they tend to swell a little.
A lot of people have swelling in their ankles who will on their own start drinking or consuming fewer fluids during the course of a day, thinking that less fluids means less swelling, and that's not always the case. How about any bladder problems or control of the bladder? Have you ever had any accidents, or
Yeah, I've had a couple.
have you? Over what period of time?
Like I finally get to sleep and over, well, I'd say at least for the past year.
For the past year?
It's just happened a couple of times.
Just a few times?
Right.
All right. Older males who have an enlarged prostate, or females with an overactive bladder, anyone who has incontinent accidents, they may deliberately drink less fluids in order to produce less urine, and therefore try to self-treat their problem by taking in less fluids, and that can put them at risk of becoming dehydrated.
Sometimes an hour later, I have to go again.
All right. And it interferes with your sleep.
Exactly.
There are several urine and blood tests we can use to diagnose dehydration. The simplest urine test probably would be just the color of the urine. Usually if you're taking in enough free water, enough fluids, your urine is going to be very diluted, so it will be pale. The less fluids you take in, the more concentrated the urine, the darker it will get. So on this samples here, someplace on this end, those dark urines will make us wonder or further look for dehydration. But a simple color test is fairly sensitive to dehydration. Mr. Johnson, I'd like to have a real quick look in your eyes and mouth.
Okay.
If I can have you look up. Usually no one test alone is diagnostic. Typically we combine a bunch of tests on exam as well as on blood tests. For example, a dry mouth certainly can be a sign of dehydration. Neck exam to look for jugular vein distension, that's not a sign of dehydration but of heart failure, having too much fluid in the lungs, which means you may or may not be on diuretics, water pills. Our nursing home patients have a unique set of problems. A lot of them clearly will be frail. They're dependent on other people for their day-to-day care, which includes nutrition and hydration. Some of those things also apply to hospitalized patients, where you can't just tell them to drink more and expect that to happen. They need, first of all, assistance in bringing them fluids, preferably things that they enjoy to drink, things that they like. There usually should not be any restrictions on our nursing home patients as far as what they drink. Even if they're diabetics and they like to drink milkshakes, we can always adjust their medicines. But it's more important to make sure they're getting enough nutrition and they're getting enough hydration and assistance with their hydration. What I'd like to do is take your blood pressure with you sitting down at first.
Okay.
I'm going to repeat it with you standing in a little bit. When you're dehydrated, or what we call volume depleted, your pressure can drop and your pulse can go up to try to compensate for a low blood pressure. We sometimes see that most pronounced when you change position. So when you're lying and you sit up, or when you're sitting up and you stand up very quickly, you can see a drop in blood pressure. Now, there are many, many things that can cause this drop in blood pressure, what we call orthostatic hypotension. Certainly medications can contribute to that. Malnutrition with low proteins can contribute to that. Heart failure can contribute to that. There's a lot of things, but certainly dehydration is one of the big things that can contribute to a drop in blood pressure. So for all those reasons I mentioned, the potential adverse effects of being dehydrated, because it's so common, it's very important to screen for dehydration, even in the patients that you might not think or they don't appear to be dehydrated. It's so much more important for patients who are dependent on their health, for nursing home patients, for hospitalized patients, for patients with advanced dementia. Those people require assistance with nutrition, with hydration. We need to have a general awareness that it is a common problem and we need to screen and treat it.
The CAM stands for the Confusion Assessment Method. It's a screening tool, and it was developed in order to identify or screen for something called delirium. Delirium is a dangerous diagnosis, as some people would say. And whether we think it's a diagnosis, a syndrome, or a complex of symptoms, whatever you want to call it, delirium is a dangerous diagnosis. Why? Because delirium has very negative outcomes. Increased morbidity as well as mortality. We also think delirium is a dangerous diagnosis because it's easily confused, so to speak, with dementia, which is very different.
Oh, no, I didn't bring him.
Hello,
It's all
folks.
right.
Hi, ma'am.
I don't know where he is.
I'm Dr. Flaherty.
Nice to meet you. I'm Sharon Jones, his wife.
Okay, nice to meet you. Mr. Jones. Mr. Jones, I'm Dr. Flaherty. The nurses asked me to come see you.
Where is